Sorry about that little low battery experience there. These things, sometimes they're tricky like that. So we're back. Thank God we had another set of batteries. So welcome to Monday morning. Today I want to talk about and reiterate that residents are still moving through our continuum of care. You know, we have residents that are moving from independent into the health center, assisted to skilled, that are in rehab and moving back. So none of that's changed, although, you know, the challenge is making sure that everybody's safe as they move through that continuum of care. So I'm going to talk about that and give you some examples about what we're doing to make sure that everybody's safe, residents, of course, and staff, as they move through that continuum of care. So I'll start by saying, I think I mentioned this before, that within skilled nursing, we've actually set up 4 rooms that are rooms that we use for the eventuality that we need to quarantine positive cases down in the health center. I don't know why my nose is so itchy all of a sudden. So even though we do not have any positive resident cases as of today, maybe I'll do this all 10 minutes. It's horrible. We still have set aside these 4 rooms, and they've been set aside for a while. Within these 4 rooms, they're kind of cordoned off. They're at the end of one of our halls in skilled nursing. We have, within each of these rooms, we actually have an air purification system. It's kind of a plug-and-play system that we purchase. They're in the rooms. It kills viruses and purifies the air as it goes. So we've invested in that. And then within, just outside of all these rooms, we have special personal protective equipment to be worn in the event that somebody is positive in those rooms. So it consists of gloves and gowns and masks and face shields and a protocol for wearing them, etc. So we have those rooms set. We do have residents that are in those rooms at this point, and they are folks that have been to the hospital. So if you heard me saying, if you go to the hospital and you're there for a period of time, and you have an acute event and then you need to come for rehab, you'll be tested a day or so before you leave the hospital. If you're negative, you'll come to us. If you're positive for the virus at that point, chances are you're still going to stay in the hospital at this point. But if you're negative, you come to us. You would be placed in one of those 4 rooms. Because even though you're negative, we're going to take an ultra-conservative approach, and you're going to be on some sort of kind of a low social isolation for the next at least 7 days. Meaning we're going to be delivering services into your room. Could be therapy services, you'll be eating in your room, some other things. The staff will be protecting themselves, and you will be required to wear a mask. And that's really, we're doing that because even though you may have tested negative in the hospital in one period of time, there's also a chance that the next day you were exposed, or there's also a chance that at the time that you were tested, your viral load within your system hadn't reached a level where it registered on the test. So I know all of these things are ultra conservative in terms of how we're looking at it, but you know, we feel like we need to be to protect the safety of all of the residents and certainly staff. So we're taking that conservative approach. If you come back from the hospital, even if you test negative, you're going to be on some level of quarantine in our health centers for a period of time as we continue to monitor you and make sure that you're completely symptom-free. Just going through my notes. If you are an independent resident and you need to move into the health center without going to the hospital, or you need to move into assisted living, let's say, without going to the hospital, and that does happen every once in a while, You would be tested. As I think I talked about last week, we have the ability to test here internally now. We have a couple of dozen test kits that we can use. We send out to the Kaleida Health Labs. So we would test you. We would have you wait for that test, and if that test is negative, then you would be transferred over to the health center, either assisted living or skilled nursing. Excuse me a second. That is allergies, by the way. It's first week in May, and my allergies are starting to pick up a little bit. So for Jeff, who's over here, and Adam, that is not COVID. That's an allergy sneeze. There's a definite difference. So again, moving through the continuum, you will get a test before you're allowed to move through any level of the continuum back or forth. Just so we have a baseline of positive or negative, and in the event that you're going into the health center, even if you have a negative test, chances are you will be on some level of quarantine for a period of time while we take an ultra aggressive approach and really monitoring your symptoms so we know for sure that you don't have the virus. Same thing if you're in assisted and you go to skilled. If you go from skilled back to assisted, same process. You'll be tested, you'll be monitored, you'll be quarantined for a period of time throughout that movement through the continuum so we can keep an eye on you. I know there'll be a lot of questions on that. That's been our process for several weeks now. Again, if you have any questions on how we move people through the continuum of care, what our testing protocols are, you're welcome to email me. It's rwallace, WALLACE, @echa.org. The other thing that we're looking at is, again, as part of planning about what Canterbury Woods is going to be in a month or 2 months from now, and that it would include the possibility, and I say it as a possibility because no decisions have been made, the possibility of opening us up to visitors, at least on the independent side, is how do you do that without testing? So I guess you could say, if you have somebody say, oh, I've been tested, bring me the sheet, the piece of paper. So maybe that's a step. But the reality is, if we could test all of our staff members today, and they could all come back negative, and then we could test all of our staff members 5 days from now, and half of them could come back positive. Just because you're tested doesn't mean you're not going to be exposed the next day, the day after that, and the day after that. So it's this rolling kind of issue that we have about what's the most effective way to make sure that somebody is not positive when they walk in the door. So you've heard some of the testings that's out there. You've heard the Abbott laboratory test. That's a serological test. There's some other testing that are similar to the Abbott testing that are out there. And we've actually had some conversations with some of these companies that are producing a similar testing kit to this Abbott laboratory testing, which is a finger prick. It's a blood on a slide, and it's about a 15 to 20 minute turnaround where you'll find out if you have the antibodies, and the antibodies tell you that you either had the virus or you currently have it. You're currently fighting it. So we are actually in line right now to purchase these testing kits from a particular company, a national company through a company called Medline, and Medline is a huge national company that distributes clinical products. So we actually can't buy the kits now. They are awaiting the emergency FDA approvals, and they expect at any time. If you're out there, if you're reading in the media, the Abbott laboratory tests, those 15-minute tests, were able to get the emergency FDA approval. This new drug, this Remdesivir or something like that. That just got approval for emergency FDA approval. So this testing process that we're waiting for, they're waiting for that approval. They can't sell it to us until they get that approval. So we're in the queue for that. And what it possibly will allow us to do is know that we can test X amount of people, potentially visitors, every single day or every single week at both sites, so that we can allow a certain number of people, number of visitors to come in our door on an ongoing basis. Now, we have to operationalize this. We still have to get it, but we're trying to forge ahead with what it's going to look like when we open the doors to Canterbury Woods for visitors and outside access and so on. This has nothing to do, by the way, for the nursing home and the health center. That's going to be a whole different issue. This is just to continue to work on systems to protect our independent residents. And, you know, I don't know how you do that extremely effectively if you cannot test on site and have quick turnaround. I don't think anybody knows what that's going to look like, but we're trying to put ourselves out there. We're trying to look at as many products as possible. We're trying to get in line for when some of these products are available, and again, design systems and protocols on how we would use them to keep you safe. So this is a moving target, but I just wanted to talk about it so that you can keep in mind that Canterbury Woods, we're not just holding pat. We're really looking at what those opportunities are going to be are going to be to open the door, let's say a month from now, 2 months from now. One other thing, this Wednesday, I won't be doing the town hall. Paul Campisi will be here doing the town hall, and he will be doing a presentation on the new app, the Touchtown app that I talked about last week, and how to access it, what's on it, how to make it work for you. You'll be able to download it on your iPhone, your iPad, on your computer. So please tune in for that. We'll get that information out there in a lot of different ways, but it'll be available at the town hall on Wednesday. Thanks and have a good day.